So keep in mind that for V-Fib and V-Tach, when there's with no pulse, the first thing you want to do is you want to provide CPR. But you can also give some medical treatment, okay? And the medical treatment option for this one is going to be amiodarone, lidocaine, or epinephrine. Okay, these are the medications that, generally speaking, we use to treat V-Fib or V-Tach. We talked about atrial flutter earlier. Okay, remember, atrial flutter is the flip-flopping fish out of the womb, out of the water. So A stands for atrial, F stands for flutter, and that will look something like this: the seesaw. Okay, this is how you know it's an atrial issue, because you see where the P wave is supposed to be. You see this abnormal seesaw action, but you still have the QRS and the T wave intact. What we do for atrial flutter is we treat it with, what we usually do is give calcium channel blockers. We could give beta blockers. These two medications, what they do is they decrease the heart rate, and that's essentially what we want to do when we have atrial flutter. We can also give anticoagulants. Okay, keep in mind that any rhythm that's fibrillation, whether it's atrial fibrillation or whether it's atrial flutter, the chambers themselves are not pumping adequately, and what they do is they aggregate the blood within the chamber. And anytime you have blood aggregation, you have an increased likelihood of developing blood clots. So we tend to give anticoagulants, usually Coumadin, warfarin, especially for long-term therapy for these patients. Now, we can also give ibuprofen. Okay, we can also give this medication because it's an antidysrhythmic drug. And then lastly, we can utilize, or we can do what we call radio frequency catheter ablation. We place a catheter inside, through the superior vena cava, inside the right atrium, and whatever cells, whatever tissues you have that are conducting this abnormal electrical signal, well, we ablate them, we remove them. We either freeze them or we cauterize them off, so those tissues will no longer be sending out this abnormal rhythm, this abnormal signal. And we can also use cardioversion. Keep in mind that cardioversion is not the same thing as your defibrillation. Cardioversion is using up to 160 joules, a lot less than your actual defibrillation.